Sidney Kimmel Cancer Center at Jefferson Health has implemented new processes and tools to deliver a proactive, multidisciplinary team approach for patients on cancer immunotherapies via continuous symptom monitoring and effective management of immune-related adverse events. First, with the implementation of EPIC, this has afforded us new technology which allows us to identify patients on immunotherapy treatments via banners in the patient chart. Why is this important? This process allows the triage team, as well as those on call, to identify which triage algorithm the team uses to manage the patient. The algorithms decrease the time from initial intake to office visit and allows earlier medical intervention. Early triage and medical intervention is critical for managing our symptoms in patients on immunotherapy. Knowing immunotherapy symptoms are a challenge and present much differently than chemotherapy. For those reasons, two sets of triage algorithms are used, one for chemotherapy and one for immunotherapy, which was created by our physician champion and our melanoma nursing team. The first immunotherapy algorithm is for the physicians on call. These algorithms follow specific clinical guidelines that circumvent an emergency room visit and provide non-oncologic physicians the tools to properly identify and treat the immunotherapy patients in a timely fashion. From those clinical guidelines and the Clinical Journal of Oncology Nursing's Melanoma Management Supplement, our nursing immunotherapy algorithms were developed. These algorithms guide the nursing staff in the assessment of the patient over the phone and empower the nurses to intervene promptly and recognize any potential life-threatening sign and symptom. A few of our algorithms include, but are not limited to, skin toxicity, gastrointestinal, hepatotoxicity, mucositis, xeristhema, type 1 diabetes, pneumonitis. For our nursing algorithms, Sidney Kimmel Cancer Center has included a nursing assessment which encompasses chart review, listening to the patient, patient education, and grading the toxicity. Once the assessment is complete, the patient is managed at home, in our same-day clinic, or admitted depending on the symptom or symptoms that are present. All symptoms recorded and tracked. Our practice developed a triage symptom note in the EHR, which is pre-populated with the most common immunotherapy, symptom grading, mild, moderate, or severe, and the action taken, whether it's observation, clinic visit, ER visit, or an admission. As part of our practice transformation, we review all the triage notes weekly for nurse compliance, ER admission usage, modification of algorithms, and continuing education. A few other initiatives to note: Sidney Kimmel Cancer Center incorporates NCCN's Understanding of Immunotherapy Effects Flyer and the Oncology Nursing Society's Immunotherapy Wallet Card. With the above initiatives, in conjunction with our physician champion and melanoma nursing team, Sidney Kimmel Cancer Center has transformed our practice, improving outcomes and overall quality of patient care.